name is Maryann Berry, and today I'm going to be teaching you exercises for mid to upper back pain and tension. I've drawn on my 10 years of experience as a posture alignment specialist, and I've taken feedback from clients that I've worked with as well as from my own personal experience in eliminating mid to upper back pain and tension, because this is something that I've dealt with myself over the years. And I've created this sequence of exercises to help to address this area. Now, here's something to keep in mind. These exercises are intended to be done in sequence, where one exercise builds on the next, and the entire routine as a whole produces intended results. So make sure that you stick around for the whole thing. To start off, take a moment to evaluate how you feel. How is your upper back feeling right now? Do you feel tension in a particular area? Are you experiencing pain or discomfort? Try to rate it on a scale of 1 to 10, with 1 being the least and 10 being the most. Also, if you have a wall available to you, I recommend that you stand up and actually stand against that wall with your heels touching, and notice if it's difficult for you to bring your shoulders, the back sides of your shoulders, and your head to touch the wall. This is going to give you a read on your body's alignment, distinct from the pain or the symptom that you're feeling. The goal of these exercises that we're going to do today is to help bring your body into a more vertical position and to help to reduce that pain and tension in the mid to upper back area. We're going to reevaluate with these things again at the very end. So like I said, make sure that you stay tuned for the whole routine to get the most bang for your buck, to get the full benefit. Exercise number 1 is called static back. For static back, you're just going to lay down on the floor and place your legs up over a block or a chair, basically something that brings your hip joints and your knees to 90 degrees. For static back, we're going to lay here for 5 minutes. So the key here is to have your arms at 45 degrees to your body with your palms up. And I'm looking at you, I'm looking directly to you, but when you're doing this, you're going to want to look up to your ceiling and just relax and let your body settle against the floor. Now, the thing with static back here, what we're doing is we're using this 90-degree angle of the hip to actually cause muscular engagement of those muscles that run alongside your spine. And what this is going to do is this is going to allow your spine to relax and release against the floor. So notice if you have an arch in your lower back or if your lower back feels flat. Now, it's fine either way. Whatever you're feeling here is totally fine. But if you do feel an arch in your lower back, what we want is for that arch to begin to settle or to flatten towards the end of the 5 minutes here. If you don't have an arch, that's okay too. Notice if your body feels asymmetrical. So maybe one side of your body feels like it's up off the floor a little bit more than the other side. And as you stay here for the 5 minutes, notice as your body just starts to settle more evenly against the floor. So I want you to practice deep breathing here in static back. Breathing in and breathing out. And just letting your body settle and relax against the floor. Notice as your lower back begins to settle to the floor. And notice as your shoulders begin to settle back and open up against the floor. Now, if this feels uncomfortable for you to have your head all the way back against the floor, what you're going to want to do is take a towel or something that you can fold and place it right underneath your head. I could even use my yoga mat here just to give you an example. But something to bring your head up off the floor just a little bit to help make this more comfortable for you. If it's most comfortable for you to have your head all the way back against the floor, then that's great too. Now, one of the things that I get asked the most often about static back is, how should I have my feet? Should I hold my feet flexed? Should I try to have them straight? And that's a great question. Really, you just want your feet to relax. So once your feet are relaxed, your feet might flop forward a little bit, and they might flop a little bit out to the sides. One might flop a little bit differently than the other, so all of those things are fine. Just try to let your feet relax and go into their natural position. Now, if your legs do go out like this, then that's just a sign that your surface that you're using is too low. So what you want to do about that is just take a folded blanket or towel and place it underneath your legs. That's going to bring your surface up a little bit higher, And that's going to allow you to get that key 90-degree angle there at your hips and at your knees. So just relax. And you do want your arms to be at 45 degrees to your body. Now the reason why that 45-degree angle is important is because that puts your scapula and your shoulder joint in a neutral position so that gravity and your body weight can have the maximum benefit of allowing that shoulder to actually settle back against the floor. So a lot of people ask me if their arms are in the right position, or how do I know if my arms are in the right position? That's a great question. Key little trick here is you can actually bring your arms up to 90 degrees, right directly out from your shoulders, and then bring your arms all the way down to touch the sides of your body, and then from there bring them to the halfway point, and that's just a nice little trick to find 45 degrees. So 45 degrees and with palms up. And we're getting close to our 5 minutes here. We have about 1 minute left. Now you're probably noticing that your body is starting to even out, that you're starting to feel more open, more settled against the floor. Make sure that you're still breathing deeply. And when you're in static back, you're going to want to resist the temptation to hold your phone over your face and to text or to try to read a book or to multitask. So I really do want you to have your arms on the floor with your palms up, with your shoulders and your upper back really still and relaxed. And breathing deeply. And that is the static back exercise number 1. Now exercise number 2 is something called static back pullovers. This is going to feel amazing on your upper back and your shoulders. To start off, bring your arms directly up from your chest, bring your palms together and interlace your fingers. Gently bring your shoulders back against the floor and straighten out your elbows. Now from here, pull your arms back for a count of 5 and return your arms over your chest for a count of 5. Pulling back for 5, 4, 3, 2, 1. Coming forward for 5, 4, 3, 2, 1. Now we're going to go for 10 reps here to start. Keeping it nice and slow, 5 count on the way back and 5 count on the way up. Keeping those shoulders back against the floor. And making sure that you keep the elbow joints locked out straight. If you notice that your elbows want to bend in order for you to get your arms around your head, I'll show you what that looks like here. You're going to want to avoid that by prioritizing keeping your elbows locked out straight. So just bring your arms as far back as you can without bending your elbows, and then bring your arms back up over your chest. That is the number 1 thing that is going to make or break this exercise, is how well you can prioritize keeping your elbow joint straight. As soon as those elbows bend, you're essentially negating the benefit here. So let's keep those elbows nice and straight and only go back as far as you can without the elbows bending. And relax. Take a little break here, bring your arms to your sides with your palms up and take a deep breath in and exhale. And we're going to start our set number 2. Again, bring your arms directly up from your chest, bring your palms together, interlace your fingers, bring your shoulders back against the floor, and straighten out your elbows. This time we're going to work in our breathing. So we're going to inhale as we pull back, and exhale as we come forward. Still 5 count, 4, 3, 2, 1, and 5, 4, 3, 2, 1. Inhaling as we pull back and exhaling as we come forward. When you inhale, you should notice your belly rising. And when you exhale, you should notice your belly moving down towards the floor. As we do these repetitions, we're going to make some fine-tuning and adjustments as we go along. keeping those shoulders back against the floor and keeping the elbow joints nice and straight. Notice the more you do these, that the easier it gets to bring your arms back without bending the elbows. Inhaling as you pull back, exhaling as you come forward. And relax. Relax your arms on the floor with your palms up. Take a deep breath. And notice how you feel. Your shoulders probably feel more open and more back against the floor. Good job on your first 2 exercises. Now we're going to get up out of the static back position and we're going to get ready for kneeling counter stretch. Kneeling counter stretch is a great way to open up the thoracic back. You're going to want to kneel facing a chair or a block, and you're going to place your elbows on your block or your chair. You're going to walk your knees back so that your knees come either directly below your hips or slightly behind your hips. And from here, you're going to kick your butt back, place an arch in your lower back, and let your chest settle through your arms. Practice deep breathing here in this position. Try to relax your stomach as best you can. And try to relax through your neck and your upper traps. And keep your weight equally distributed from right to left through your knees, both elbows. You're going to feel a rather intense stretching sensation through your lats, your shoulders, and your upper back. Breathing in and breathing out. Let those shoulder blades drop together in the back. And once the minute is done, walk the knees in and come on up. Next is upper spinal floor twist. Now the purpose of upper spinal floor twist, as the name implies, is to twist and rotate the thoracic back. So what you're going to want to do here, and I'm going to use a yoga block to help demonstrate this, you're going to want to lay down on your side with your hip joints and your knee joints at 90 degrees. So you don't want your legs down like this. You don't want your legs up like this. You want them right in the middle with the knee joint directly out from the hip. Now, the key to this exercise is you want your kneecaps in the same plane. So I'm going to demonstrate that by placing this yoga block here on the front sides of my kneecaps. You're going to want both knees touching that block. Now, you can use a tissue box. You can use whatever you have there that is basically a nice flat surface. Get both kneecaps in the same plane. And you're going to want to keep them there by taking your bottom hand and holding on to your knees so that your top knee stays on top of your bottom knee. Now take a moment here to line your head up with the rest of your body. So your head should be in line with your spine. You're going to take your top arm, place your palm down on the floor, and open up, bring your arm all the way around your body towards the opposite side, and turn your head to look in the direction of your hand and your arm. Use your bottom hand to hold those knees together. Now your number one priority is to keep those knees stacked. I know I've said that several times now, but be sure to keep those knees stacked. Look in the direction of your hand and your arm and breathe. Practice deep breathing here into the lower back. Breathing in so that the lower back area expands, and breathing out so that the lower back retracts back in. As you're holding this position here, you want to make sure that your feet stay flexed and your head is staying right in line with the spine, and you're just simply rotating the head to look in the direction of the hand. You do want your palm facing the ceiling. You're going to want your fingers open nice and wide. And And as you hold this position, just notice as that shoulder opens up and comes towards the floor. After a minute is up, you're going to come out of it the same way you came into it by bringing your top arm all the way back. You can let go of your bottom arm and bringing it all the way back to meet your bottom arm. And take a breath here and just let your rib cage and your spine adjust. We're going to switch sides. So we're going to do the same thing on the opposite side, and I'm going to use my block here to help demonstrate. Lay down on your side with your hips and knees at 90 degrees, and take your yoga block, your tissue box, whatever you have, and bring that top knee directly on top of the bottom knee so that both kneecaps are in the same plane. From there, you're going to take your bottom hand, you're going to hold on to your top knee, and you're going to flex your feet by pulling your toes up towards your body. Bring your top arm towards the floor so that your palm faces the floor, and line your head up with the rest of your spine. I forgot to mention this on the other side. If it's more comfortable for you to place a towel underneath your head, you can go ahead and do that if that helps to bring your neck and head in a better alignment with your spine. Now from here, you're going to open up your top arm. You're going to bring that top arm all the way towards the floor behind you. You're going to want to turn your head to look in the direction of your arm and breathe into your lower back. As you hold this position here, that upper back area is going to rotate and open up, which is going to allow your shoulder to come towards the floor. So just notice as that shoulder begins to open up, and make sure that you continue to breathe into that lower back area. At the same time, keeping your feet flexed. You're going to keep those toes pulled up and keeping your kneecaps in the same plane by holding your knees together. Breathing in and slowly breathing out. Your palms should be facing the ceiling with your fingers open, spread nice and wide. And again, you're turning your head and actually looking in the direction of your hand. And notice as that shoulder begins to drop back and open up towards the floor. After 1 minute is up, you're going to take that top arm, bring it all the way back to meet your bottom arm, and take a moment here to take a breath and let your rib cage and your spine adjust. Now finally, we're going to finish off with an exercise called pelvic tilts. The purpose of pelvic tilts is to engage the muscles of the pelvis and the midsection in order to promote a better spinal position throughout the entire spine, including the mid to upper back. So for pelvic tilts, you're going to want to bring your arms out to 45 degrees with your palms up. And you're going to want to bring your feet into your butt and then walk your feet away from your body until your hips feel nice and comfortable against the floor. Line your feet up pretty close together so that they are 5 inches apart, and initiate a movement from your pelvis to tilt your pelvis forward to create an increased curve in your lower back. Really accentuate that curve. And then tilt your pelvis all the way back to flatten your back, but don't lift your butt. Do not lift your butt. This is not a bridge. So again, what you want to do is tilt your pelvis forward to create an arch in your lower back, and then tilt your pelvis back to flatten that arch without lifting your butt. We're going to inhale as we tilt forward and exhale as we tilt back. We're going to go through 10 reps of pelvic tilts. Inhale as you tilt forward, exhale as you tilt back. And make sure that you're not tensing through your upper back or shoulders in order to try to create this pelvic motion. Now, if you are tensing in your upper back and shoulders, that's going to actually negate the benefits of this exercise. So if you notice that happening, stop, take a breath, reset, and try to get all of the motion to come from the pelvis. Also, you're going to want to make sure that you're not pushing with your feet or your lower legs. Inhale as you tilt forward. Exhale as you tilt all the way back. And one more rep. And done. And you are all done. Good job in getting through the entire sequence there. Now let's take a moment to reevaluate. So stand up against a wall, bring your heels all the way back against the wall, and notice how your body feels in relationship to the wall. So notice that your shoulders feel back, your upper back feels straighter, your head probably comes back to touch the wall a little bit more easily, a little bit more naturally. And also just take a moment to notice how you feel on a scale of 1 to 10, comparing the pain or the tension that you were experiencing at the very beginning to what you're experiencing now. If you enjoyed this video and you'd like to see more videos like this in the future, click the subscribe button, and when the little bell icon appears to the right, click that bell and select your notification preferences so that you can get notified when I post new content. And if you can think of somebody in your life that could benefit from this video, please share it. And if you want to connect with me, I'd like to invite you to join me on my Facebook page. I'll post the link to my Facebook page in the comments below or in the description below. I post daily to Facebook, so please join me there if you're interested in receiving more detailed, in-depth movement and exercise tips like this video. Thank you so much for joining me, and I look forward to seeing you in my next video. Bye!